Welcome to SAT2 Career 2.0 online nursing channel. In today's video, again we are going to discuss 20 important questions for AIIMS Nursing Officer Exam 2020. So don't skip the video, watch all the 20 important questions with rational so that it is going to helpful for you in giving the AIIMS Nursing Officer exam in the month of September 2020. So before that, if you are not yet our subscriber, please subscribe to our channel Sat2 Career 2.0 online nursing channel and click the bell icon to get the latest notification about all our new videos. Now let's see the first question in this video. Which of the following would be an expected finding in an age assessment of a 2-year-old child? Option A has a 300 word vocabulary. Option B uses one hand to turn the pages of a book. Option C runs with a white stance. Option D all of the above. So 2-year-old child, when you assess which finding you can expect, the right answer is all the above findings are commonly seen in a 2-year-old child. The rationale very simple. A 2-year-old child, a patient should have reached certain developmental milestones. The child will be developing their vocabulary and in addition to knowing almost 300 words, will be developing 2 to 4 sentences. The child may start using one hand to complete tasks and favoring one hand over the other. The child may start running as well as walking and standing on tiptoes. A child who is lagging in performing these milestones may be at the risk for developmental delay and further assessment is indicated. Hope you understood. Now move on to question number 2. Which of the following symptom would support a diagnosis of Crohn's disease? Option A fatigue and headache. B rectal cramping and bleeding. Option C stomach swelling and gas. Option D all of the above. So in Crohn's disease, the symptom which is supporting the diagnosis, the right answer is option B rectal cramping and bleeding. That symptom will support the diagnosis of Crohn's disease. The rationale: rectal cramping and bleeding would be the most consistent in supporting a diagnosis of Crohn's disease. While it is unclear what causes Crohn's disease, patients almost always present with these symptoms. Fatigue and headache could result following the blood loss in Crohn's disease, but would not be used to make a definitive diagnosis. People with Crohn's disease may experience stomach swelling and gas. These are also symptoms of inflammatory bowel disease. So here that is the difference between the symptoms of inflammatory bowel disease and Crohn's disease. Now let's see the third question here. A patient is suffering from heart failure. Which of the following would be recommended by a nurse as a part of the patient's healthcare plan? Option A discouraging a diet of fruit and vegetables. B checking for swelling of the lower limbs. Option C encourage the daily intake of fluids. Option D encouraging vigorous exercises. So when the client is suffering from heart failure, we need to recommend the patient to check for swelling of the lower limbs. So when there is suspect of heart failure, encourage the patient to check the swellings is present in the lower limbs or not. Rational: swelling of the lower limbs known as edema is due to a buildup of fluid from an impaired circulatory system and is a common side effect of congestive heart failure. It would not be appropriate to discourage fruits and vegetables as they are part of a heart healthy diet and should be encouraged. Patients with heart failures are usually put on a water regimen for around 1 to 2 liters of fluids total per day. This is due to the increased pressure of the heart to process fluid and may cause worsening edema. Patients with heart failure need to be careful with the amount of vigorous exercises activities they undertake. Heart rate should be monitored closely to prevent overexertion. So this is the rationale for the question number 3 answer. Now move on to the fourth question. A patient has had diarrhea for the past 72 hours. Which of the symptoms would support a diagnosis of hypovolemia? Option A light colored urine output. Option B, decreased pulse rate. Option C, wet muscle membranes. Option D, disease spells. So when you suspect a client for hypovolemia who is having the history of diarrhea for the past 72 hours, the symptom which supporting the hypovolemia is option D, disease spells. The rational hypovolemia indicates low fluid volume within the body. Dizziness spells would be one symptom of hypovolemia due to the decreased pressure in the brain. Urine would be dark colored, not light colored, as the urine contains more byproducts and the kidneys processes less fluid. An increased pulse rate would indicate hypovolemia as the heart works harder to spread the limited amount of fluid volume throughout the body. A patient would have dry mucous membranes as fluid is directed towards more vital body organs. So this is how we need to uh, find out the supportive symptom which is diagnosing the heart failure, sorry, the hypovolemia. Dizziness spells is present. Now, question number 5. Which of the following infectious control methods should be used when caring for a patient with bacterial pneumonia? Option A. Wear a mask when taking vital signs. Option B. Do not allow flowers in the patient's room. Option C. Do not allow visitors. Option D. Request the patient to use disposable eating utensils. So, following the infectious control methods, when caring for bacterial pneumonia client, the nurse should option B wear mask when taking vital signs. The nurse should wear mask when taking vital signs when you are caring for a client with bacterial pneumonia. The rationale: a patient with bacterial pneumonia may spread the disease through droplets from coughing or sneezing. Droplet precautions would be appropriate. A mask is required to prevent inhalation of droplets containing bacteria. Flowers can be allowed to be brought into the patient room as this should not worsen the patient's condition unless the patient has an allergy. Proper sanitation measures are acceptable when handling the utensils used by the patient on droplet precautions. Visitors can be allowed provided a mask is worn with the room of a patient who may be coughing. So this is the rationale for your fifth question answer. Now the sixth question. A patient is having a tonic-clonic seizure. A nurse should take which of the following steps? Option A. Put a pillow under the patient's head. Option B. Put restraints on the patient. Option C. Lay the patient on his back. Option D. Use a tongue blade on the patient. So now the patient is having tonic-clonic seizure. So the step to be followed by the nurses. Option A. Put a pillow under the patient's head. The rationale: putting a pillow under the patient's head is an acceptable way to prevent injury to the patient until the seizure has completed. Putting the restraints on the patients may cause further injury to the patient and will not prevent the muscles from moving. Putting a tongue blade in the patient's mouth may cause injury to the oral cavity and may cause the patient to choke. So it is more appropriate to put the patient on the side as this may help to prevent aspiration as well as prevent injury to the head. Now, seventh question. Which of the following patients should a nurse recognize as having an increased risk of breast cancer while doing a breast cancer screening? Option A, a 44-year-old who has had 5 children. Option B, a 28-year-old who is breastfeeding her first child. Option C, a 35-year-old who started her menstrual cycle at the age 12. Option D, a 61-year-old who has not had any children. So the client who is at the risk of getting the breast cancer among these four is option D, a 61-year-old who has not had any children. Now move on to eighth question. Sorry, the rationale of the seventh question. The risk for breast cancer is increased in elderly patients who have not had children. Patients who have had children are at less risk for breast cancer than those who have not had children. Breastfe- Breastfeeding decreases the risk for breast cancer. A patient who started her menstrual cycle at age 12 would be in decreased risk for breast cancer. A patient with irregular cycles or who started at an early age may be increased risk for breast cancer. Now, eighth question. A nurse just started a blood transfusion for a patient with a hemoglobin of 6. The patient says, I feel hot, my stomach hurts, and I am having difficulty in breathing. What should be the nurse's first action? Option A, notify the physician. B, stop the infusion. Option C, take vital signs. Option D, call a code. So while starting blood transfusion, when the patient hemoglobin level is 6 and patient says he is feeling hot and the stomach gets hurts and having difficulty in breathing, the nurse first action should be to stop the infusion. Option B, to stop the infusion is the right. Now the rationale, the first action should be to stop the transfusion immediately once the patient complains of any unusual symptoms. The patient is reporting symptoms of a transfusion reaction, therefore the transfusion should be stopped to prevent the patient from worsening. The provider should be notified immediately. The healthcare provider should be notified immediately after stopping the transfusion. Vital signs should be taken as quickly as possible or as instructed by the provider after the transfusion has been stopped and the physician has been notified. A code should be called if the patient becomes unresponsive. A rapid response could be called if the patient is at the risk of destabilizing. So this is the rationale for answer of the question 8. Now the ninth question. The nurse enters the room of a patient complaining of lower back pain after a hip replacement surgery. What non-pharmacological intervention would not be appropriate? So listen the question. What non-pharmacological intervention would not be appropriate? Option A, reposition the patient onto the left side. Option B, massage the patient's back. Option C, lower the head of the bed and elevate the patient's leg onto a pillow. Option D, apply a warm pad to the patient's back. So when the client is complaining lower back pain after a left hip replacement surgery, the non-pharmacological intervention which is not appropriate, the right answer is option A, reposition the patient onto the left side. That is not appropriate non-pharmacological intervention here. The rationale, if possible, the patient should not be repositioned onto the side where the hip surgery took place, as this may cause decreased circulation or improper healing to the hip or cause more pain to the patient. The patient can be repositioned from supine to the right side. Massage is an appropriate method for nursing staff to use in decreasing pain for the patient. It is appropriate to lower the head of the bed to elongate the patient's back. The patient's leg may be elevated to prevent swelling and pressure ulcers. The application of heat to a painful area is appropriate. It would be acceptable for the nurse to obtain a doctor's order prior to heat application. Now let's see the 10th question. Which of the following statement to the type 2 diabetic patient by the nurse is correct? Option A, eat less fruits and vegetables and more grains. Option B, try to wear closed-toe shoes whenever ambulating. Option C, minimize physical activity to prevent fatigue. Option D, check your blood sugar only after meals. So the statement related to type 2 diabetes, which is correct, the right answer is option B. Try to wear closed toe shoes whenever ambulating. The rationale, the correct statement by the nurse is that the patient should wear closed toe shoes when ambulating. Patients with diabetes are at high risk for impaired sensation in their lower extremities and may develop wounds that are difficult to heal. Patients with diabetes should be encouraged to eat more fruits and vegetables as a part of a healthy blood sugar regulating diet. Increasing physical activity is another way for patients with diabetes can regulate blood sugar levels. If the diabetic patient is checking the blood sugar, the levels would normally be checked prior to meals, typically to determine a dose of insulin. Now, the 11th question. A nurse is working in the telemetry unit, receives a call that a patient's EKG rhythm has transitioned into atrial fibrillation. Which medication is the patient likely to receive long term in relation to his diagnosis? Option A, warfarin, B, heparin, C, furosemide, D, albuterol. So when the nurse receives that patient's call that says EKG rhythm has been transitioned into atrial fibrillation, so the medication which is likely to receive by the patient in long term in related to the diagnosis option A, warfarin. The rationale, warfarin is a common medication given long term in the management of atrial fibrillation to prevent the development of blood clot or thrombosis that can cause blockages in the heart or lungs. Heparin, while used to prevent thrombosis in atrial fibrillation, is not usually administered long term as it is an IV or subcutaneous injection. Furosemide is given as a diuretic in decreasing fluid retention. It is normally given to patients with congestive heart failure. Albuterol is typically a drug that is inhaled in the treatment of COPD or asthma as a rescue medication. So it is contraindicated in atrial fibrillation. So hope you got clear with the rationale. Now the 12th question. A patient has incentive spirometry order 4 times, that is with 10 breaths after a cholecystectomy. The patient is asking why they need to perform this action. Which of the following would not be a reason the patient should use the incentive spirometer? Option A, to decrease lung capacity. Option B, to gently exercise the lung. Option C, to improve recovery time. Option D, to prevent pneumonia. So why the incentive spirometer is used after the cholecystectomy surgery? The right answer is option A, to decrease the lung capacity. The rationale using an incentive spirometer will increase the lung capacity, opening the bronchioles and allowing for better oxygenation throughout the body. Using an incentive spirometer gently exercises the lung and will encourage the patient to take long and deep breath instead of short and shallow breath, which are common following stream, will improve recovery times, allowing the patient to start ambulating sooner as well as encouraging the proper healing to the surgical site. Incentive spirometry uses it is used to prevent pneumonia by keeping the bronchioles open and clear. It also minimizes and sustainable environment for pneumonia to develop. Now let's see the correction in this question. So here it is not decrease, it is to increase the lung capacity. So in the question, the option A, to increase the lung capacity, it is not to decrease the lung capacity. Now let's see the 13th question. A nurse is changing the dressing for a post-operative bilateral knee amputation patient. The nurse notes that the patient refuses to look at the limb while the dressing is being changed, but asks the nurse about their personal life instead. Which nursing care plan should the nurse implement for the patient related to this action? Option A, disturbed body image. B, altered sleep pattern. C, impaired memory. Option D, impaired social interaction. The right answer is option A, disturbed body image. So once the client had bilateral knee amputation, the priority nursing diagnosis will be disturbed body image. The rationale, a patient with the loss of limb may be experiencing disturbed body image. The nurse should be sensitive to the patient's emotional and mental acceptance of the loss and incorporate the therapeutic communication as the patient allows. Acceptance may take time and the patient should not be pressured into looking at the limb. Now, the 14th question, which method should be the last resort in assisting a patient who is experiencing mild anxiety? Option A, deep breathing. B, therapeutic communication. C, progressive muscle relaxation. Option D, administration of haloperidol. So which intervention is the last resort in assisting a patient who is experiencing mild anxiety? The right answer is administration of haldol. So directly for mild anxiety, we don't give any anti-anxiety drugs or antipsychotic drugs like haloperidol. It should be the last choice of treatment. The rationale, non-pharmacologic methods should be used prior to pharmacological methods. Haldol is normally given to patients experiencing severe anxiety or agitation and should be used at last resort. A patient may benefit from the nurse sitting with them and providing calm conversation over the anxiety causing issue. Deep breathing is well-known calming technique used to calm the nervous system and can help in cases of anxiety or panic attacks. Progressive muscle relaxation can be used to encourage the patient into a more relaxed state. The nurse can assist the patient to lay on the bed and provide instructions to the patient into a slow, calm voice. Progressive muscle relaxation would be much helpful in reducing the mild anxiety. Now, question number 15. In which of the following ways can the nurse promote the sense of taste for an older adult? Option A. Mix foods together on the dinner tray. Option B. Avoid cologne, air fresheners or room deodorizers. Option C. Encourage the patient to chew the food thoroughly. Option D. Discourage the use of salt or seasonings with the prepared food. So in this case, the thing which we need to encourage the patient to do to regain the taste sensation is option C. Encourage the client to chew the food thoroughly. Now, the rationale, as client is aged, their sense of taste may diminish, reducing the joy that comes with eating. A nurse can promote the sense of taste for a client by encouraging him to chew his food thoroughly while eating. This results in longer contact of food with the taste buds and a greater chance of tasting the food. Now, 16th question. Which of the following is classified as a pre-renal condition that affects urinary elimination? Option A. Nephrotoxic medications. B. Pericardial tamponade. C. Neurogenic bladder. Option D. Polycystic kidney disease. So, pre-renal condition which comes affecting the urinary elimination is option B. Pericardial tamponade. The rationale, a pre-renal condition is that which causes reduced urinary elimination due to a diminished blood flow to the kidneys. A condition such as cardiac tamponade affects the heart's ability to pump adequate amount of blood, thereby reducing the blood flow to vital organs throughout the body, including the kidneys. Now, the 17th question. At the beginning of the shift, a nurse receives report for her daily assignment. Which of the following situations should the nurse give first priority? Option A. A diabetic client with the blood glucose level of 195 milligram per deciliter. Option B. A family member of an elderly client who has questions. Option C. A client with COPD with an oxygen saturation of 84%. Option D. A client who requires assistance to use the bathroom. So at the beginning of the shift, the nurse receives the reports regarding her daily assessment. So which situation client should get the first priority in care? The right answer, option C, when the client oxygen saturation level is 84%, who is diagnosed with COPD gets the first priority. The rationale, when prioritizing the needs of client, the nurse must begin with the unstable client or manage conditions that affect the airway, breathing or circulation first. The client with COPD has a condition that affects breathing and is exhibiting decreased oxygen saturation level. Therefore, this client should be the first priority. Now move on to question number 18. A client has started sweating profusely due to intense heat. His overall fluid volume is low and he has developed electrolyte imbalance. The client is most likely suffering from option A. Malignant hyperthermia, B. Heat exhaustion, C. Heat stroke, option D. Heat cramps. So when the heat is increasing, the client getting the chance to develop heat exhaustion. So the rationale, the heat exhaustion occurs when a person has enough diaphoresis that he becomes dehydrated. Intense sweating can cause both fluid and electrolyte imbalances. Untreated heat exhaustion can lead to heat stroke, which results in organ damage, loss of consciousness, or death. Now let's see the 19th question. A nurse is attempting to assess a client's pulse in his foot. She palpates the pulse on the anterior aspect of his ankle, below the lower end of the medial malleolus. Which type of pulse the nurse is taking? Option A, dorsalis pedis. Option B, popliteal. C, posterior tibial. Option D, femoral. The right answer, very simple. The nurse is auscultating posterior tibial pulse. The rationale, the nurse can palpate the posterior tibial pulse to assess circulation to the foot and ankle. The posterior tibial pulse is felt by palpating the inner side of the ankle behind the medial malleolus. So this is the rationale for answer of the 19th question. The 20th question, which of the following condition is contraindication for performing a diagnostic peritoneal lavage? Option A, a morbidly obese client. Option B, a client with a femur fracture. Option C, a client with hypertension. Option D, a client who is 9 weeks of pregnant. So in which condition it is contraindicated for performing a peritoneal lavage? The right answer is option A. In a morbidly obese client, this is contraindicated. The procedure peritoneal lavage is contraindicated. The rationale, diagnostic peritoneal lavage is a contraindicated in clients who are morbidly obese because of the excess body fat makes the finding essential landmarks for this procedure difficult. Additionally, the equipment used for the procedure may not be large enough to accommodate an obese person. Finally, morbid obesity puts excess strain on the cardiovascular and respiratory system, such that anesthetic agents used during the procedure could cause further complication. So this is the reason why there is difficulty in doing the procedure. This is peritoneal lavage in a morbid obese client. So in this video, we have completed the 20 very important questions and interesting questions for the AIIMS Nursing Officer exam preparation. In another video, I will show another 20 interesting and important questions we will see with rational. So thanks for watching this video, and you also can learn through our social media like Telegram, WhatsApp and Facebook channel. The link is given in the description box. You can click and you can join today. And please like this video, comment about this video, and subscribe to our Satu Career 2.0 online nursing channel. If you like these two videos, you can click and you can watch, and we will meet again with another 20 important questions tomorrow. Till that, take care, bye bye, stay safe, stay alert.